Today, we're going to dive into a condition that's super common, but for some reason still kind of whispered about: irritable bowel syndrome, or IBS for short. Just think about that for a second. 1 out of every 10 people on the planet. That's a huge number. It means you definitely know someone who's dealing with this, or hey, maybe it's something you're navigating yourself. So here's the big question we're really going to get into today. If it's that common, why does it still feel so confusing, both for the people who have it and for everyone else trying to understand it? All right, to really get what IBS is all about, we've actually got to hop in a time machine. Because this isn't some new modern problem. It's a medical puzzle that doctors have been trying to piece together for well over a century. Can you believe that? All the way back in 1892, this really famous doctor, Sir William Osler, was already writing about symptoms we'd recognize in a heartbeat today. Belly pain and weird changes in bowel movements. What he was seeing back then is pretty much the first official description of what we now call IBS. So yeah, this has been on the medical radar for a long, long time. Now here's a super important clue, and it's hidden right there in the name: irritable bowel syndrome. That word syndrome is everything. It tells us we're not talking about a disease with a single, easy-to-find cause. Nope, we're talking about a recognizable pattern that's made up of a whole group of symptoms. Okay, so at its very heart, IBS always involves some kind of abdominal pain or discomfort. But here's the key. That pain is directly tied to a change in your bowel habits, so either more diarrhea or more constipation. And listen, while it's often a lifelong thing you manage, there is some really good news here. It is manageable, and importantly, it doesn't raise your risk for serious stuff like bowel cancer. So, if it's all about a pattern of symptoms, how in the world do doctors actually diagnose it? Well, this is where it gets a little tricky, because there's no single simple test you can just go and take. And this is a really, really fundamental point to get. Unlike so many other conditions, you can't just get a blood test or an X-ray and get a definitive yes or no for IBS. The diagnosis is all about a doctor recognizing that specific pattern of symptoms we were just talking about. To make things official, doctors use a kind of checklist. It's called the Rome 4 criteria. You can think of it in 2 steps. First, the person has to be having belly pain that comes back, on average, at least 1 day a week for the last 3 months. And then step 2, that pain has to be linked to at least 2 of these 3 things. It's related to going to the bathroom, there's a change in how often you go, or there's a change in how your stool looks. And it's also important to know that IBS is definitely not a one-size-fits-all condition. It gets broken down into 4 main types. You got IBS-D, where D is for diarrhea. There's IBS-C, where C is for constipation. IBS-M is for a mix of both. And then there's the less common one, IBS-U, for unclassified, which is for patterns that just don't fit neatly into the other boxes. A huge, huge part of the whole diagnostic process is just making sure it's not something else. Doctors are trained to look for what they call red flag symptoms, things like losing weight without trying, anemia, or seeing blood. These kinds of signs suggest that maybe, just maybe, another condition is the real culprit here. Okay, let's tackle one of the biggest, and honestly, one of the most damaging myths about IBS. This whole idea that it's all in your head. The truth about the brain-gut connection is way more complex, and frankly, way more fascinating. The link between what's going on in our mind and what's happening in our gut is just incredibly powerful. This quote here points to a study where people with IBS reported way more stressful life events than people who didn't have it. This isn't just a feeling, It's a real, measurable scientific finding. And take a look at this. This chart shows data from a massive study. We're talking over 50,000 people, and the results are just crystal clear. Folks with IBS were significantly more likely to also have anxiety. It's a really powerful visual that shows the overlap between our gut and our brain. So let's just be absolutely clear about this. IBS is not all in your head. The physical symptoms are 100% real. But it's a two-way street, a constant communication highway. Stress can absolutely trigger gut symptoms, and an unhappy, inflamed gut can turn around and impact your mood. They're always talking to each other. Okay, so we get what it is, we get how it's diagnosed. Now for probably the most important part. What can you actually do about it? Let's open up the management toolkit. For a lot of people, some pretty simple first steps with diet can make a world of difference. This usually means cutting back on common irritants, things like caffeine, alcohol, super spicy stuff, or really fatty foods. And on the flip side, some supplements have shown real promise, like peppermint oil to help soothe discomfort, or a soluble fiber like psyllium husk. Now, for a more tailored approach, a lot of people try what's called the low FODMAP diet. But this is not a forever diet, okay? It's a short-term plan where you temporarily get rid of certain kinds of sugars, the FODMAPs, to try and figure out exactly which ones are your personal triggers. It's kind of like becoming a detective for your own gut. And managing IBS isn't just about what you eat. There are therapies that directly target that brain-gut connection, like acupuncture, mindfulness, and cognitive behavioral therapy, and they've shown real success. Sometimes doctors might even prescribe a low dose of an antidepressant, not because you're depressed, but because those meds can actually help calm down the hypersensitive nerves in the gut. So as we start to pull all these pieces together, it becomes really clear that managing IBS effectively means you've got to look at the bigger picture, the whole holistic view of your health. This is a really important question for anyone out there who might be feeling totally stuck, like you're at a dead end. You've changed your diet, you've tried the therapies, but you're just not feeling better. So where do you go from here? Well, there are two really critical questions to ask yourself. First, go all the way back to the beginning. Are we absolutely 100% sure this is IBS? It is always worth double-checking that some other condition hasn't been missed. And second, take a really honest look at that brain-gut axis. Is there unaddressed stress or anxiety or even past trauma that could be secretly fueling your physical symptoms? Ultimately, the foundation for long-term relief is about shifting your perspective. It's moving beyond just playing defense and avoiding triggers and starting to play offense, actively building a healthier, stronger, more resilient gut microbiome through your diet and your entire lifestyle. So I'll leave you with this. Don't try to solve everything all at once. Just think about this. What is one small positive step you can take for your gut health starting right now, today?
Click the subscribe button to stay updated with VitalSpan Labs.